Hi, fellow SPARTA scholars. Here is my capstone for 4.5.1 Storytelling Using Data. Scenario: COVID-19 presentation for possible solution. Target number of audience: 10 to 15 people from CITY Hall of Caloocan that will represent the following departments: City Health Department, Caloocan City Medical Center, Barangay Secretariat, Office for Senior Citizens Affairs, and Disaster Risk Reduction and Management. Topic will be Singapore, Race in Flattening the Curve. Which country is not racing to flatten the curve? Well, yes, there are 15 countries who's not affected with it, which means 180 countries are struggling to fight the third pandemic of 21st century. We always hear the phrase flattening the curve. For people that do not know the definition of this, it refers to slowing the spread of the virus as to not overwhelm the capacity of healthcare system of the country. Let's see how and why Singapore make it from Southeast Asia's worst to world's best placed amid pandemic. From staggering unmanageable daily rate of almost 1,000 at the end of April 2020 and start to plunge down to one-digit community case by June. Imagine controlling the uncontrollable by 2 months, and by only a year, Forbes ranked Singapore the number one to be the world's best place for you to live during pandemic. Maybe you are thinking right now, how obedient and disciplined their citizens in following the rules? Or is it the government is totally prepared on this kind of situation? Let's find out the lessons we can learn from Singapore and how we can apply it to Caloocan. Before we jump on the reasons, it will be better to understand the invisible enemy, the COVID-19 virus. Let's familiarize ourselves with the virus. World Health Organization groups symptoms into three: most common, less, and serious symptoms. And for not to strain the healthcare system, WHO advised people infected with less to most common symptoms to manage their health at home. The virus spreads and mutates rapidly that our technology can cope up. Let's be aware how the virus being transmitted. Respiratory disease spreads through the droplets coming from the infected person when they sneeze, cough, or even talk. Infected person's saliva or any kind of respiratory secretion or droplets may be inhaled or land to others' eyes or nose. When those droplets reach any surface, it can contaminate those objects, creating fomites. Have you read Forbes' publication that WHO now admits the COVID-19 is airborne? Now it's said that infected person can spread the virus even by a meter apart due to aerosols. Aerosols can be produced by mere exhaling of the infected person. What should we remember in avoiding to protect ourselves and others? Vocalization. Droplets and aerosols can be produced by merely talking or exhaling. So if we stop talking in a public place, we will contribute in the safety of all people around us. Volume of interaction. This is when people come together and spend long time talking to each other. Venue, a close proximity setting like in restaurants and not well ventilated public places is a good venue for the virus to spread horrifically. Now that we understand COVID-19 virus deeper, the symptoms if you are infected, the way how it was transmitted, and the trivias to remember to avoid the virus, the next step is to know the responses implemented by Singapore government to achieve the world's best place to stay while in pandemic. December 31 of 2019, WHO was informed by Chinese government about the unknown cause of pneumonia and fluorine in Wuhan City. On 2nd of January, thermal scanners were deployed at Changi Airport, and on the other hand, Ministry of Health advised doctors to monitor suspected cases. After 10 days, multi-ministry task force was formed. It was co-chaired by ministers from Ministry of Health and Ministry of National Development. This is to direct the national government response, coordinate with the local, and work with international community on regards of the outbreak. On the following day, MOH announced the first confirmed case of novel coronavirus. 2 months after Wuhan alerted WHO about the unknown pneumonia, and total of 18 confirmed imported cases as of that day, and no evidence yet of community spread, Task Force advised the public to wear masks if only feeling unwell. 4th of February 2020, the first locally transmitted cluster or group of people infected was identified in Yongtai Hang Medical Hall. Just after 3 days, Disease Outbreak Response System Condition or DORSCON was raised from yellow to orange. How it impacted the daily lives of residents of Singapore? At workplaces, employers are required to take staff's temperature twice a day, and unwell should immediately leave the office. At schools, extracurricular activities was immediately suspended. The ministry advised the event organizers to cancel non-essential large-scale events. Visitors coming from China were banned entering Singapore. All Singapore citizens coming home was required to complete a 14-day stay home notice from when they arrived from 17th of February onwards. A hefty amount of $10,000 will be fined if they prove that you breached the stay home notice protocol under Stay Order Regulations of 2020. Safe distancing measures was implemented on public venues announced on March 13. Keep at least 6 feet apart while you are in public places. A mobile app was launched by Government Technology Agency in collaboration with Ministry of Health. This mobile app is to prevent the use of any pen and paper to log in your entry in any establishments. The adoption of this effort was immediately implemented nationwide, from schools, offices, and every public places, even on trains. The app works by exchanging short-distance Bluetooth signals between phones to detect other trace-together users in close proximity. On 23rd of March, all short-term visitors from anywhere in the world are not allowed to enter or transit through Singapore. Border closure took effect on the same day at 23:59. Closures of entertainment, sales, events, tours, and even religious services effective by 26 March. The circuit breaker was announced publicly by Prime Minister Lee, and here's what was reported cases that day. In just 2 weeks, the number of infected persons admitted in a general ward was doubled. Singapore's National Center of Infectious Disease has 330 beds but can only expand and accommodate more than 500 during an outbreak. Thus, Ministry of Health scaled up medical facilities and introduced a tiered medical plan in avoidance of exhausting the country's hospital resources. National development set up different isolation facilities outside hospitals. These were community care, people who have tested positive for COVID-19 and who have mild symptoms and lower risk factors are being cared for in these facilities. Community recovery, patients who remain well at the end of 14th day after being diagnosed positive and who do not require further medical care may be moved to these facilities. Swab isolation. These facilities are for patients awaiting the result of swab tests to prevent the potential spread of COVID-19 in the wider community. These isolation facilities will be totaled around 37,000 beds only by June. On that day, there is a 20% of death percentage against inpatients required intensive care. Ministry of Health grouped the number of cases into three. Imported. As we all know, these are the Singapore residents returning to Singapore. Dormitory. They are foreign migrant workers who resides in a dormitory type of housing. They are doing a wide variety of works like construction, shipyard, haulier drivers, and even the works at parks. They are the main concern due to be having a congested way of living. Some quarters have more than 7 beds each and social distancing is very impossible. Community are people who are resides in government flats, landed houses, or private condominiums. 5th of April is the start of the biggest spike of community transmission in Singapore. The Dorscon Orange Circuit Breaker was implemented on April 7 to May 4. As you can recall of Dorscon, there are only 4 alert types. Instead of jumping to red for a total lockdown, Singapore implemented a so-called circuit breaker. Residents can still go out but advise that it must be only essential errands like buying food, grocery, or exercising at the public park. Malls were open to cater the food supplies, but non-essential businesses like bubble tea shops and retail departments were closed. To ensure non-congestion of public places, government agencies launched websites to give real-time update on crowd level information. National Environment Agency promotes the use of websites like Space Out for malls and NParks advises to refer to safe distance at parks. Due to the continuous surge of the infection, on 14th of April, the Ministry of Health mandated the wearing of masks once you step out from your own house. Based on research, as you can see on the table, almost 70 to 100% in reduction on risk of infection. Overall community benefited in wearing masks. The anticipation of lowering the cases in 3 to 4 weeks was seen as impossible, thus the result of circuit breaker extension. But now it's more tighter. They implemented a odd even entry on some wet markets and groceries. Prime Minister advised only one person from every household should be away from home at any one time. As seen on drastic lowering down of numbers on June 1, as promised, circuit breaker was lifted and presented the roadmap in reopening the economy. As of 27 May 2021, Singapore recovered patients are 61,372, which is 99.08% and only 0.05% death. On their ongoing vaccination, as of May 31, there are 1.7 million residents completed 2 doses administered by either Pfizer or Moderna vaccine. And as of the same day, Singapore only have 16 confirmed community cases. Except for this is a pandemic that really needed an urgent and effective responses. What are the other reasons for Singapore? Who doesn't want to urgently end this pandemic, right? But Singapore has these facts to address COVID-19 with top priority. Singapore ranks third on the most dense populated country in the world. There are 7,810 persons per square kilometer, and we now all know that distance plays a big role in breaking the chain of transmission. As advised on my previous slides, they are avoiding to stretch out the health workers' capacity. The data shows that they only have one nurse per 133 people, one doctor for 400, and 2.5 hospital beds for every 1,000 patients. Many governments are focusing on economic and livelihood effects. But aside of it, COVID-19 is likely to have a more serious effect on mental health. If we will take the Singapore's Institute of Mental Health study as the baseline, it highlighted that 1 in 7 people in Singapore has experienced a mental disorder in their lifetime. It was 2018 report. Major depressive disorder affected 6.3% of the adult population of the city-state. Just last year, 2020, Suicide Prevention Organization received a spike of 18% calls on their helpline. And Singapore Counseling Center also stated a 40% increase in the number of clients. Now that we know the facts and responses implemented hand in hand by Singapore government to fight the COVID-19, what is the answer on our question at the beginning of this presentation? Are the residents really obedient or is the government totally prepared on this kind of situation? As of February this year, there are record of 8,600 fines issued in breaching social distancing and not wearing a mask. This only means that not all residents are obeying the rules. Are they prepared? As you can recall, there are limited healthcare workers and beds available. Like other countries, Singapore is not totally prepared, but they resolve the issues instantly. I want to highlight on this talk is the reason why Singapore ended up in ranking number one for Bloomberg's COVID resilience ranking. It is data. Singapore has a clear-cut data, updated data on regards of its population, health departments, and budgeting. Now this is the reason why selected departments from Caloocan City was invited not only for us to take this simple presentation, but to take action in gathering data of the city and hoping one day Caloocan City will be named as one of the resilient city in not only in the Philippines but in the world. Questions. If there are no questions, I'll be the one to post some of it. How to start gathering data. You can start from getting the number of population in the barangay, the names, addresses, how many dependents in each household, and the location of their work. That is the main reason we invited member of Barangay Secretariat. Through trainings that was held yearly with barangay officials, we can look ways to disseminate on why data is important and how to accurately collect it. Other than data gathering, any other lesson we should learn from this? Organized and united leadership. This may take a while, but we need to start somewhere. I would love to end this talk with one of Lee Kuan Yew's quotations, Singapore's founding father. The task of the leaders must be to provide or create for them a strong framework within which they can learn, work hard, be productive, and be rewarded accordingly. And this is not easy to achieve. We may not have the foolproof data sets yet of Caloocan City, but with this first step and help of the leaders, we will get there.